fabulous Fiona Daly from the National Sustainability and EFM Workforce. She's the lead there at NHSEI, and she's going to talk to us. This is a biggie. This is a biggie. Decarbonising the NHS estate. Blimey, Fiona, good luck, girl. We all want to hear it. Tell us how to do it. Tell us. We're all yours. Thank you.
Okay, right, let's give this a go then. Presentation mode. Right, sure. There we are. All good? Good. So thanks very much for the introduction. As John said, I'm Fiona Daly. I'm the National Sustainability and Estates and Facilities Workforce Leader in NHS England and Improvement. We sit at the centre and provide guidance to everybody within the NHS and all the sustainability people, managers and executives in looking at how they can decarbonise the NHS estate. So I'm sure that you're all aware, but the UK has committed to become net zero by 2050. It was the first major economy to pass a zero emissions law. And since then, there's been many companies who have sort of tried to beat that target. And I'm sure the NHS will soon follow suit in trying to do that as well. But it was underpinned by a whole load of legislation really leading up to that. So the Climate Change Act, the DEFRA 25-year plan, and the Clean Growth Strategy, all of which sort of went into creating the need for net zero to be a thing. And in the NHS specifically, we've obviously had a massive kind of extended period of trying to reduce costs and increase efficiencies. And sustainability, especially in terms of the estate, has really been something that's been a focus of that for quite a few years now. I'll just sort of glass over this a little bit because Kim has already spoken about it. But in the long-term plan, there were some very clear deliverables around the need to reduce emissions, to improve local air quality, to reduce plastics and anaesthetics, and to drive energy efficiency. And I think that comes with more of a societal drive. I think we've all seen it with the Extinction Rebellion, with the school strikes, as we've said, the new legislative change, and as Phil touched on, the kind of move to the digital revolution, how we can look at sort of digitalising what we're doing, and the real sort of urgent need to address some of the social and health inequalities that we've got in the UK increasingly. There's a massive economic impact to this, and I think that we've seen it through COVID, you know, how a global pandemic can really cause what I'm sure will be a global recession shortly. And I think that climate change, and specifically around decarbonisation of the estate within the NHS, has a massive opportunity to kind of redress some of those things. And why the NHS estate? Okay, so we're pretty large. We've got around 26 million metres squared of hospital estate, so that is colossal. We've also got primary care estate on top of that, NHS dentists and pharmacies. We have got a huge estate, and we are the largest single public sector contributor to energy, and I think that that's one of the reasons why the NHS is so keen to ensure that we really sort of take strides to improve that. We spend, last year we spent £670 million on energy alone. So that's just heating and lighting our estates. We spent a further £150 million managing our waste, so that's clinical waste, recyclates, and everything in between, and £84 million on water. So a really chunky amount of cash that we're spending on running our estate. And obviously it's a very visual sign when people come to our hospitals, they're in it. We've got a big backlog maintenance bill, so that's a lack of investment over a long period of time. But we're starting to see a bit of a change, and last year the NHS invested £64 million in energy efficiency projects across its estate. So we're really starting to see the tide turning. And the executives, it was great to hear from University Hospitals Birmingham about the work that they're doing. And I know that work is happening up and down the country to try and improve the situation. So in 2021, not only did the NHS kind of do its long-term plan, but we also wrote some very specific things into the National Operating Plan. So this is a set of requirements for all NHS hospitals to kind of follow. And there was some very clear direction of travel around sustainability, and especially around the estate. We've asked for every organisation to purchase renewable electricity by April 2021. That's something that's very simple to do. It will have a massive impact if we put our £300+ million worth of electricity spend into the green energy sector. That's both from a carbon perspective, but also from stimulating the green economy. We've made a commitment that all of our new build hospitals, so the new 40 hospitals that are being built through the healthcare infrastructure plan, are all going to be built to net zero carbon. That is a challenging thing to do, but we've committed to do it, and we have all the support to do that. There are some other things which are a little bit more business as usual in there as well. So we're launching this year a stretch programme, which is a list of interventions that everybody can undertake within their organisation, either low or no cost or very easy to implement. The replacement of LED lights as routine. Those are the sorts of things that people should be looking at anyway, but I think it's really important that we put it in there as a kind of measurable outcome. All organisations have been asked to sign the Green Pledge for plastics, so reducing their use of single-use plastics across the estate. We're looking at cutting fleet emissions, cutting emissions from some of the more problematic CO2 producing anaesthetic gases and inhalers as well. So these are all very, very clear things that have been requested to every organisation through the National Operating Plan. I've put a link in here to, I assume, John, that you'll circulate the slide so everybody can kind of take a look at that in more detail. You need to look at pages 17 onwards. So I just thought that I would focus on the main sort of crux of what we're doing. So we've obviously got a massive estate and you know, a lot to do. There's a lot of backlog maintenance. We're not going to rebuild all of the hospitals in England, but we still need to achieve the net zero carbon targets by 2050. So what exactly is it that we can do to achieve that? And our programme really focuses on three core areas, and the first of which is leadership. So that's organisational leadership, but also personal leadership. So how we act in our everyday lives, what we do in our everyday lives, how we act when we're in the NHS as managers, managing services, and the decisions that we make. So it was great to hear that organisations are looking at their green plans and putting those in place. We really encourage all organisations to have a green plan. We produced some joint guidance with the SDU a couple of years ago to kind of look at that. But it's really interesting. We tried to see if there was a correlation between organisations who had a green plan and their CQC rating, and organisations who had a green plan were likely to have a 9% increase in their CQC rating. So that's quite a good thing. We think that link is clearly through the well-led organisation and the fact that they're probably taking their social responsibilities seriously. But that was a really nice thing to see. There are some really practical things as well, like the Sustainable Development Assessment Tool, and I know that I think it was Philippa who mentioned the HOT tool, so the Healthy Outcomes of Travel tool. All of those things are available to use, and I really, really encourage you to use them. They're great tools. They help you to plan what you're going to do and also measure where you are and measure your impact and your route map to where you want to get to. And then the final thing is really reporting. So reporting where you are every year. It's really important for the board to have visibility of where you are and what you're doing. They can't really sort of show that strong sense of leadership if they're not aware of how an organisation is doing or the kind of things that organisations lead, like investment, like training. So that's kind of the first area that I'd encourage you all to kind of take a think about, you and yourselves as leaders and how you show up every day and how much of an impact you can have. The second part for us is clearly about the estate. So better buildings for our patients, how we create a cleaner, greener, net zero carbon NHS estate. And there are many, many aspects to this. I've put in, because I've only got 10 minutes to talk to you, but I put in a bunch of case studies at the end of this presentation for you to look at in your own time, and that kind of goes into a bit more detail of some of the things that we're doing. The LED lighting programme, we're investing £50 million in LED lighting last year and this year, so we delivered £30 million last year, we've got £20 million to deliver this year. There is a clear need to do more of that, and as part of the comprehensive spending review, we'll look to upgrade that so that we can get 100% coverage across the whole NHS estate. As I said, we're looking for every organisation to buy renewable energy, but we're also looking for people to put on their sites, on-site renewable energy generation. It's a great thing to do. It has no emissions in terms of the actual in-use. Clearly, there's some emissions associated with making the kit itself. But really, really good long-term and very visual thing that organisations can do. We're creating a national energy strategy for health, so that will really show how all of these things are linked together and help you hopefully over the next 10 years to sort of set out your strategy. And I think there's some really chunky things in there. The NHS over the last 10 years has added £200 million onto its energy bill, and that is purely from unit rate increases, and that's only going to get more as we get more and more carbon tax. We're clearly looking to reduce waste and water. We have a clinical waste strategy coming out this year, and we'll have a domestic waste and recycling strategy coming out following that. We are really pushing the boundaries of innovation. We have an AI trial going on at the moment. We're looking at how we can look at new models of care, how we can reconfigure our estates to really support the clinical changes that are needed to drive sustainability and low carbon. And then there's some really basic stuff. You know, we clearly need guidance and support. We're developing some net zero carbon guidance. We've got a capital planning tool for net zero carbon that we're going to release this year. We've got a client brief for the new build hospitals, which will show how to plan to get to net zero carbon. And we're developing a net zero carbon hospital standard. So that will be a sort of certificated standard along with the UK Green Building Council and the British Research Establishment, and that will be ready hopefully by the end of this financial year. And data, I mean, I just cannot push the point of data enough. It's quite boring to some people, but it is so important for correct decision making. So when you're looking at things, please interrogate your data, make sure your data is right, make sure you understand the data for your area. I think that would be the one thing that I would ask everybody on this call to do, is just to kind of go back and find out your data, check it and make sure it's right, because that's really what drives decisions both at a local level, and it will at an ICS level, a regional level, and it does for us nationally. You know, we need to be making good data-based decisions going forward. And clearly there's quite a lot of opportunity for efficiency savings. We've taken a lot of money out of the bottom line so far. The LED lighting project alone will save £18.5 million every year for the NHS. So just really, really good sound things to do. And then the third part of our approach really is about using people as catalysts for change. You know, you are healthcare managers, you are critical to implementing this and implementing best practice. We have got a bunch of tools and toolkits and training available, and we can make all of those available to John so that he can make them available to you all. I think it's really, really important that we kind of get this, we train everybody understands the basics of not only net zero, but for a greener NHS, why we're doing anything about climate change in general. I think that there are very clear links between the climate emergency and the health emergency. Simon Stevens has very clearly said so. There's a massive impact on air pollution and air quality, and that's leading to a lot of respiratory disease. We can go on and on and on. But I think that it's very important that every single one of our 1.5 million employees understands that and acts in a way that they're really trying to tackle it every day. And that means we really need to transform the way that we do business. So, you know, how we show up in our organisations, absolutely critical. How we spend our time, how we spend our money, what we invest in, when we're doing tenders, what are we putting in those tenders that specify, you know, reducing net zero carbon. And educating everybody in our teams, how they can make a difference in their jobs and what they're doing. And I think that will be really, those areas will really lead to us transforming the way that we do business in the NHS. So that is all I had to say. As I said, I've put in about 10 case studies of things that we're working on at the moment, from the net zero carbon tool to the green leases sort of framework. They're really practical things that we're trying to put out into the system. So Terry, I have questions? Has everybody gone to make a cup of tea?
You do indeed. I'm just going to share the result of the word cloud poll,
wow.
where you ask the top 3 things that we can do at the centre to support NHS managers. Well, it's glaringly obvious what the most commonly suggested thing was. You do have a number of questions which we don't have time to go through all of them, so I'm going to ask a question about, will there be an opportunity to review the capital projects which were agreed at the end of 1920 before the new requirements, to make them meet the net zero standards?
Sure. So I think I say a couple of things on this. So one is, don't assume that net zero means additional cost. If you plan it from the beginning and you design everything from the beginning, and you're at the beginning of your project, there is no reason that it needs to cost any more, or that amount, if it is any more, needs to be significant. We know that one hospital who replanned their design had a 1.5% increase in their overall capital cost, which is very small compared to what some people think it is. The second important point, I think, is to say that we have put in a very significant bid for the comprehensive spending review. So that's a review across government where all the departments are able to put in requests for funding. And that includes funding for items such as decarbonising heating, which will be flowed into the HIP schemes and the waves 1 to 4 capital schemes that are still in delivery, as well as across the retained estate. And I think the final thing is, if you are struggling or you are coming up against sort of a lot of additional costs, contact us, because we have some really good tools to sort of help you to hopefully unpick those. It does depend on where you are in your schemes. We don't have a large pot of money at the moment, but there is a lot of capital being flowed into the system. So fingers crossed, and I've do my best to get everybody as much capital as we can as part of the comprehensive spending review.
Thank you, Fiona. We really appreciate the practicality of your presentation. I think